So my second case study is titled A Healthcare Provider's Role in Reducing HIV Prevalence in Low-Income Areas. So a little background on this case. Dr. Smith, who is a primary care physician, volunteers at a health clinic in a low-income area. A patient comes in complaining of a low-grade fever, a weird rash on his neck. So the Dr. Smith immediately just requests for an HIV test to be done to eliminate if there is any chance. The test actually comes back positive. The doctor then has to tell the patient that he has tested positive for HIV. Dr. Smith then assesses the patient on his previous sexual encounters, his drug use, and interaction with anybody he might know that does have HIV. The young man stated that he occasionally uses condoms because his partner is on birth control pills. This right here demonstrates the lack of knowledge he has in the preventative care with transferring of diseases, and strictly believes condoms are just a use to prevent pregnancy and doesn't know the other beneficial factors of them. So the focal problem here would be, how can medical professionals decrease HIV diagnosis in low-income areas? Next, I included just a chart of HIV prevalence, the HIV prevalence rate by age and ethnicity. As you can see in the chart, it is drastically higher in poverty areas than in the U.S. overall. And this chart is presented to us by the CDC, and it states that the HIV prevalent rates in urban poverty areas are inversely related to household income. So the lower the income, the greater the HIV prevalence rate. So the proposed solutions that this doctor has to help decrease the HIV prevalence rate is, number one, to further education. Discussing preventative measures with the individuals and the young adults in the area. For instance, in our case study, how that patient didn't realize the benefits of condom use and just strictly thought it was for pregnancy. Another area to educate on would be a medicine called PrEP. And this is an alternative for people who are not infected with HIV, but who are at a very high risk, which is a lot of these poverty areas that we're looking at. Individuals take a pill every day, and this drastically lowers the risk of an individual's exposure to HIV by 92%. So that's a very large percent that a lot of people aren't educated on and don't really know of. After doing a little research, a lot of doctors don't even know to present this information to patients, and this could definitely help out in these poverty areas where there is a high risk of HIV. Next would be community outreach. So having this doctor partake in health campaigns in the community, specifically focusing on this demographic or similar demographics to this low-income area. So allowing young adults to realize that this is a real issue and this is happening in your neighborhood and to your ethnicity, to your race, to across the board. So that would be very beneficial as well. Next and lastly would be to have state and federal financial assistance, or further the state and federal financial assistance. Offer free HIV testing or low-income treatment to people who already have HIV. This is the thing that could be going on, but maybe it is not well known in the community. So advertising and marketing for free HIV testing and letting people know that are in these economically disadvantaged areas that low cost or free treatment or HIV testing is a possibility for them will make them more inclined to want to partake in getting tested and preventing the spread and incidence of this disease.